Hello, everyone, and thank you for joining the CannAtlantic Conference, the country's first Mid-Atlantic Cannabis Conference, brought to you by the Philadelphia Association of Black Journalists. If you're watching this particular session, this session is all about the state of medical marijuana. Medical marijuana markets are all over the country, and other states are actually coming online as they legalize cannabis for medicinal use. But in the age of adult use legalization, where a lot of medical markets are switching to adult use or integrating adult use legalization, where does that leave patients, researchers, scientists, people who really support and really respect and understand and want to know more about the medical and the wellness aspect of the plant? And so we're going to be talking about a bunch of things related to medical marijuana, and we will be leading this conversation and moderating this conversation is Tamara Russell, a Philadelphia Black journalist who I'm very excited to lead this conversation. She'll talk a little bit about herself, and then she will introduce the panelists, and the panelists will introduce themselves as well. So we'll pass it off to Tamara and enjoy the session. And thank you, Tamara, for moderating this panel.
No problem. Thank you for having me. Peace, 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 everyone. Like you said, my name is Tamara Russell. I also go by POC, which stands for Proof of Consciousness. I am a radio host and media correspondent here in the city of Philadelphia. You can find more information about us at reviveisalive.com. And if you are someone who's on social media, on all social sites, you can follow us at revive_POC. And I'm your moderator today for this conference when it comes down to this panel discussion on the state of medical cannabis. And I'm going to take it to Dr. Rachel Knox.
Hi, everyone. I'm Dr. Rachel Knox. I'm one of the Knox docs or Doctors Knox, and you can check out who we are at doctorsknox.com. But, you know, I wear a lot of hats around the medical cannabis and cannabis industry at large. I'm a very proud board member of the Minority Cannabis Business Association. I joined the organization in 2016 as the medical chair. Since that time, I've done so many things as a clinician, researcher, and educator in the cannabis space. Most recently, my main hat has been as the chair of the Oregon Cannabis Commission, because reform is still an issue in Oregon, where I reside, and we're still trying to get medical cannabis right. So I know we'll dive into that conversation here shortly.
Yes. And next we have Martin Lee.
Yes, thanks very much. Martin Lee. I'm the co-founder and director of Project CBD, which is a nonprofit educational platform that focuses on cannabis science and therapeutics. 10 years ago, our small group was instrumental in introducing CBD into the medical marijuana community in California, and it really spread from there, and it's become a huge phenomenon now. Although I have to emphasize that we are not cheerleaders for CBD. We are advocates for medical cannabis, and that it's important to, I think, situate CBD in that context. And I'm very happy to participate in this discussion. I was formerly one of the co-founders of FAIR, Fairness and Accuracy in Reporting, which was a journalist organization advocating for the working journalist in the context of corporate media. So this brings together many of my interests to be focusing on cannabis today in this discussion.
Awesome. So as you can see, we have some amazing panelists for you all this evening. So let's go ahead and get started. Let's get ahead and get with our first question. Our first question for the evening is going to be a very common question that we all hear, is how do I find a doctor to recommend my medical cannabis for my qualifying conditions? What are some of the steps that you will recommend? And we can start with you, Dr. Rachel.
All right. In most states that have medical cannabis programs, any doctor can write an authorization for the use of cannabis as medicine. That doesn't mean every doctor will. Right. And I think that's why this question is so common, because sometimes a person's already designated primary doctor or primary specialist is unwilling to evaluate them and sign off on their use. Because of that, we have seen, especially in California, but in other states too, an increase in the cannabis clinic or the cannabis card clinic, where patients can go and see a doctor who is providing that service as their primary service. In some states, there are registries that will publish and promote doctors who do authorize. Some states, those registries do not exist. I think marijuanadoctors.com has been helpful. I think that's the first website that comes to mind that actually provides a registry of that nature that might be helpful. In Oregon, we are pushing our medical program to publish doctors who want to opt in to promoting themselves, because at the end of the day, access is the number one issue around patient and total equity for all people, including people of color. But we need to know where to go to get comprehensive oversight and care, not just a signature on authorization that says we have a qualifying condition and can use cannabis. We want people to use cannabis appropriately and safely too. And so hopefully it'll be much easier from here on out for patients to find doctors who are willing to help them and work with them in using cannabis so that it actually makes that difference they're seeking.
I definitely agree with you, especially on the point where you say promote, actually put yourself out there, because one thing that I know and I learned firsthand is that it's very hard to find a doctor, and it's not like you can call your insurance company and say, hey, what's a doctor that can really help me with this situation? Yeah. So I definitely agree with that. And Martin, what would be some tips that you would recommend?
I would also add to Dr. Knox's suggestion, the Society of Cannabis Clinicians. It also has a list of doctors and medical professionals who are involved with that association, and it's actually an international association. It started in California. And I think that's a really good resource. One of the big challenges, I think, is oftentimes doctors really aren't, for lack of a better way of saying it, aren't really hip to medical cannabis, and maybe are skeptical, didn't learn about it in medical school, and then are rightfully hesitant to go pontificating about it or recommending it or prescribing it. So, it's tricky. There are some real incredible exceptions, Dr. Knox among them, who are doing great work in the United States and elsewhere. But oftentimes it's the patients who are teaching the doctors in this situation. And I think that's situations that occur or continue for a while. Because we are really in an intermediate phase with medical cannabis. It's really an incredible phenomenon when you think about it. Something that was totally illegal, a grassroots, a real authentic grassroots rebellion, if you will, has put medical marijuana on the map in the United States, has resulted in legalization in one form or another in a majority of states. And that in itself is an incredible story. But unfortunately, the medical profession as a whole, and I hesitate to paint with too broad a brush here, but it's sort of been kind of on the back of the caboose, they have not been leading the way. It really has been patient experiences that have been forging the way in this, and I think it's an incredible story.
I like to say legalization happened to medical providers. It happened to us, and now we're forced to respond. And the only last thing I'll say on that, I know we want to get to other questions, is that my family founded American Cannabinoid Clinics because we wanted to provide patients with an alternative to the card clinic, right? Where they could come and seek advice, ongoing management from doctors who have taken the time to read the science and taken the time to learn enough to help patients navigate the what, when, how I use a cannabis product for a certain condition. And I think that's what Martin was alluding to. The endocannabinoid system, cannabis medicine, let alone the endocannabinoid system, right? Physiology in the human body that doctors should know about is not being taught in our medical school. So when cannabis happened to us, we were de facto at the end of the caboose. So, there's a call to action right now that's out, and hopefully more medical providers will arise to the occasion.
Great point, both of you. Definitely some good points in there. Thank you for the recommendations as well. I want to get to the next question. So this is a question where, I know a lot of people utilizes this term, marijuana. Where do you think the term marijuana came from? And why do you think society still uses the term marijuana versus cannabis? And we can start with you, Martin.
Okay, well, the word marijuana is actually it comes from the Spanish language, comes from Mexico, and it's a slang word. It became inserted into American culture as a result of the early on war on drugs. It's part of the reefer madness campaign. It was sort of used as a truncheon to put people over the head, to associate an herb that they didn't know a lot about necessarily with immigrants, with minorities, with people who were portrayed as stealing white America's jobs, that kind of thing. So it was part of a racist campaign. So it's a tricky word. Some people are have very, very strong feelings that you shouldn't use the word marijuana. You should use the word cannabis.
Agreed.
I, as a writer, respect people's opinions, and if however you want the word to be used, I'll use it that way. But as a writer, I like to be able to use a lot of different words for the same thing. And it turns out that cannabis or marijuana, there's literally 100 words for it in the English language, slang words. And I think that underscores how significant it is in our culture. You don't have in Eskimo culture, you have 50 words for snow. We have hundreds of words for cannabis. So that's something about the significance of cannabis in our culture, despite its kind of curious social and legal standing that we're still working through.
Yeah.
Thank you.
And happy to jump in. Yeah, so for me, from a medical perspective, I would prefer that medical doctors use the word cannabis. I would also prefer for legislators to use the word cannabis, because both hemp and marijuana, which are both non-scientific regulatory designations, are cannabis. And both hemp and marijuana have nutritional and medicinal value. So when it comes to medicinal cannabis, we could be talking about hemp or marijuana, right? All we're talking about is cannabis of almost endless chemical profiles these days, with an arbitrary distinction between hemp and marijuana being that 0.3% THC. It's all medicinal. So I don't mind us using this non-scientific designations of hemp or marijuana to be clear about what side of the spectrum that we're talking about at any given time, but it's all cannabis. So I do take a little bit of issue with people saying hemp and cannabis, because hemp is cannabis and it continues to other THC and marijuana. And the reason why I really don't like legislation using that term is because we have spun it pejoratively. And if we continue to use the pejorative term marijuana to other from hemp, then I think that we're going to continue to try to regulate it like a vice. We're not going to move the needle far enough, fast enough towards normalization if we keep calling it recreational marijuana. When it's cannabis and people can recreate with it, but it's medicinal first, and all of it's medicinal.
Great points. Thank you for that. And I want to ask you that goes into my next question. When it comes down to your research, what side of the spectrum do you see yourself researching more? Is it the business/grower side information, or is it the customer/patient side information? And I'm going to start with you, Dr. Rachel.
For me, it's everything. It's everything. And I'll tell you why, and I'll tell you a bit about myself, and what I've been up to over these past years in the cannabis space. So I'm a clinician, right? At the end of the day, I see the patient or the consumer, or sometimes the consumer that becomes the patient. Because in adult use markets, sometimes the consumer goes to the dispensary or first, and they wind up in our clinic anyways. As that clinician, I've been able to see what does and does not work for patients coming out of those retail shops, right? Because of what I've learned through science, right? That has helped shed light onto what cannabinoids or what terpenes, what chemical profiles might make more sense for one condition or another. Take anxiety versus PTSD versus pain versus cancer, right? There is no one size fits all approach in cannabis. There can't be, and there shouldn't be. But because unfortunately, there still exists this gaping hole between what's available on dispensary shelves versus what patients actually need to adequately treat their medical conditions, we've had to learn a lot about the entire supply to solution chain. Every step of that supply chain matters when it comes to creating a medicinal finished good. And so in that sense, I've learned a lot from the seed to outcome supply and demand network. And I've been able to apply that knowledge to my work in policy and regulatory consulting. You know, as the chair of the Oregon Cannabis Commission, I've had to know a thing or two, again, about that entire supply and demand network. And unfortunately, what is true is that this ecosystem, right, this cannabis ecosystem is still heavily siloed. It's integrated by default, but not in a strategic way, such that our economy of cannabis is truly productive of high and consistent quality medicinal goods that promise efficacy. We're not there yet. We need to connect all those dots, and it's going to require us to take a bird's eye view and analyze the industry as an ecosystem in order to ensure that we are creating efficiency throughout the entire supply and demand network, such that, again, we are consistently process improving to the tune of ensuring high quality, consistent, and efficacious products for patients and consumers.
Thank you for bringing that full circle for us. And Martin, how can you follow up to that when it comes down to your type of research or what you're interested in? Do you lean more on the grower business side or patient consumer side?
More on the patient consumer side, or really the medical science side. But I have to say that from the 10 years ago, when we first rediscovered CBD in Northern California, we had really, two sets of great possibility here, kind of two parallel directions. One is that we thought this could be tremendously useful potentially for people, if indeed CBD proved to be as therapeutically valuable as it was for mice that the scientists were discovering. And I think that has played out. But the other thing is we were always very conscious of the social implications of CBD and of healing, in the sense that we thought that CBD could be key to liberating cannabis from the drug abuse paradigm. And that's very important, because we're moving out of that paradigm, but we're still partially in it. And I think that the social implications, the social economic implications, the cultural implications of liberating cannabis from the drug abuse paradigm, goes beyond just an individual's healing capacities, which, that's the bottom line ultimately. But we always saw this as having a great potential for changing society. And but it's not guaranteed to go that way. And I think we're in a situation where an underground economy is emerging. It's partially above ground, partially not. It's partially legal, partially not. And how is this going to play out? How is it going to play out into the future? Who's going to end up with the chips? And is it going to be a handful of companies dominating the whole space, as is typical in the American economy? I certainly hope not. And it doesn't have to be that way. So how will this emerging economy be regulated? Will it be regulated in terms of promoting the ethos of a Green New Deal? I would like to see that personally. And I think cannabis has potential playing a very significant role in that regard. But also in terms of integrating what we call single payer or Medicare for all, has tremendous implications for health in our society. So it's really kind of it's up for grabs, and it brings us down to political realities of the day, and that we have to work to make sure it comes out in a better way than it likely would had we not taken a stand.
Yes. And I want to move forward a little bit, and I want to get into the federal side of things when it comes down to medicinal cannabis. So as of right now, the federal government still has not legalized medicinal cannabis. How does that actually affect the medicinal cannabis industry? And Dr. Rachel, I'll start with you again.
Oh, man. I mean, the consequences of persistent prohibition at the federal level are vast. It's not until more recently that universities, right, academic institutions have been allowed to study the plant. For a long time, they could only study synthetic cannabinoids, which is how we discovered the endocannabinoid system in the first place. So it's great that they were able to use a synthetic analog of THC to do so. But to this day, it's incredibly difficult to research cannabis to the tune of everything we want to research it for, right? From safety to its efficacy in treating medical conditions, both chronic and acute. You see a lot of research going on around the world, especially during COVID-19, uncovering that cannabinoids, CBD, other cannabinoids, including terpenes, might be beneficial in treating some aspects of COVID-19 even. But are we studying that in the United States? No, because of federal prohibition. And that's, to me, that's unfortunate, because our own federal government, through the Department of Health and Human Services, applied for a patent in 1999, which was awarded in 2003, that declared cannabinoids as medicine, right? Cannabinoids as treatment, as antioxidants, and as anti-inflammatories for neuroprotection, and went on to list several chronic diseases that are very common in the United States today: Alzheimer's, Parkinson's, right? Ischemic injury, that means stroke or heart attack, right? And so, it has me scratching my head, where we have the federal government saying that, no, you cannot make any medical claims for cannabis or CBD or cannabinoids at large, while they hold on the public domain a patent that declares cannabinoids as medicine. So, that double speak, if you will, is going to continue to persist and only favor the few in control until we deschedule. And I do believe in descheduling and not rescheduling, because of the ongoing weaponization of cannabis against people of color.
Mm-hmm. And with that being said, Martin, can I actually direct a different question to you to follow up what she said? When it comes down to policies, can you name one unique policy that you have seen a state actually implement that is very, different and unique when it comes down to medicinal cannabis?
Well, one of the problems is that each state has its own set of rules. And so you have a patchwork quilt of different regulatory policies from state to state where cannabis has been approved for either therapeutic or adult use. And then you have, of course, some other states where CBD is legal, but not cannabis as a whole. So it's sort of a kind of a mishmash. And then the federal government continues to play a role that inhibits and sort of chops off at the knees progress in an area that we really desperately need. In terms of a state, as an example, well, I'm most familiar with California, and Project CBD was involved in as consultants with the Cannabis Control Bureau in California, particularly giving input in terms of regulations regarding pesticides and solvent residues. The problem that all states faced when regulating how much of a particular pesticide, and I have to say pesticides are everywhere and in everything, because just the drift alone, there's nothing that comes in totally clean in terms of cannabis. But what's a permissible level of a pesticide? And I think in terms of what California has done, given the obstacles and the challenge they faced, the fact that there was no scientific data for potential harms of what happens when you burn a pesticide, when you change it and then inhale it. It's different from if it's on a piece of fruit or a vegetable. There's a lot of data on what is considered by the federal government a permissible level of a pesticide and something you ingest. But what happens when you heat it, you change it, and then you inhale it? There's no data for that. And I think that California has done a pretty decent job in terms of trying to deal with this issue and setting standards where there really wasn't any to begin with. But they got a long way to go. And obviously it's not perfect, but I think that they were receptive and they really were trying to do what's best for consumers and for patients in this regard. But this is an issue that's going to continue to haunt all the states and the federal government, for that matter, when it finally comes time to deschedule cannabis. How do we deal with the fact that tobacco companies basically got off scot-free and they never had to provide the data of what happens when you smoke tobacco, a cigarette laden with pesticides, because the federal government just said, well, tobacco is dangerous anyway, so we don't need to know about those other things. And as a result, states are all short-handed, and they've had to do whatever they could in that regard. So I think that's one example to answer your question.
Yes. And Martin, while I have your attention too, I want to just ask you another question. When it comes down to reciprocity, how could you just sum that up in a really quick statement for us, what reciprocity actually is and how beneficial it could be to patients?
Well, when I understand by the term reciprocity, it means if you're in a state where it is legal for you to use medical cannabis, you've gotten a certification from either a letter from a doctor or a card from the state. Okay, I'm in California. What if I go to Hawaii? Can I use that card and access the remedies and so forth that are available under the Hawaiian medical cannabis program with my card from California? If I could, that would be an example of reciprocity, that the states recognizing each other's validity in that regard. Unfortunately, again, here it's a kind of a mess and a mishmash, and it's hard to know what's going on in terms of one state to another. There's not a lot of reciprocity, I have to say, not as much as there should be.
Mm-hmm. And Dr. Rachel, I have a different question I want to ask you. When it comes down to cannabis having, a good market, what does a good cannabis market look like to you?
Oh, a good cannabis market to me looks like cannabis. It doesn't look like medical versus recreational or adult. It just looks like medicinal cannabis and also industrial cannabis. So to me, the cannabis industry and cannabis market of our future from state to state or nationally or even internationally is a cannabis economy divided between its industrial and medicinal uses. Now, if we just shift over to just medicinal, though, that's what it is. It's medicinal. Can adults 21 and over choose to recreate with it? Sure. Mm-hmm. But I would really like us to stop distinguishing between medical and recreational, because as long as we continue to use words like recreational, then we are opening the door wide open to regulate it like a vice. Mm-hmm. And it is not. It is a medicinal healing substance that, yes, needs to be used with some intentionality, right? There's a spectrum of use from appropriate use to misuse. And when we say misuse, what we mean is, like, especially for people who are trying to use cannabis for a particular reason, like treat pain, misuse might mean misdosing, right? Not using the right dose or the method most aligned with efficacy or desired effect. And then there is abuse, right? And the spectrum is wide open. But if we really want to get a handle on regulating this industry with integrity, then we're going to regulate medicinal use such that our supply, right, that supply to solution supply chain is productive of high and consistent quality medicinal product, meaning that the sickest of us, the most immunocompromised, can go into a dispensary and get a safe product that also an adult over 21 can access for whatever purpose, for enjoyment, for recreation, because I care that recreational user, that adult user, is also getting a high quality and safe product. So that's the industry that I want to see, one that we don't bifurcate or trifurcate to its own destruction. It's highly inefficient. It is overly redundant. And at the end of the day, the end consumer and the supply chain operators are having to pay a heavy price for this type of regulation. That it makes it more expensive. It really does. And it needs to be sustainable and scalable. And it never will be if we continue to bifurcate and trifurcate it.
Thank you. I appreciate that. And I want to ask this last question to both of you, because this last question is a question that actually came off Twitter as I was promoting, the conference for today. Someone actually submitted a question to me and they said, I would love to get your opinion on when it comes down to vaping. Would you recommend that a patient, uses or consumes medical cannabis with vapors? And this is a question to both of you.
Yeah, my preference these days are aerosolized products. So inhalers are coming onto the market for both hemp-derived and marijuana-derived product. And what that means is that you can inhale cannabis through a non-combustible. So we don't have to worry about combustion and, heating. And terpenes are super volatile. We don't want to lose those through the heating process either. So aerosolized products are what I highly recommend these days, especially in the COVID-19 era, where we want to minimize any destruction to the airway, which is our first line of defense against viral pathogens. So that's my preference today, quite honestly. Just skipping over smoking and vaping right to an inhaler.
I appreciate that. And
I
Martin,
can see about vaping. Actually, we have Project CBD just put out another report about vaping and some of the safety issues there. It's up on our website currently, projectcbd.org. Vaping's tricky. I think it's in theory, it's a great way to access cannabis, to administer cannabis. But the vaping market, as it were, is largely unregulated, particularly in the CBD vaping market. And I would really caution people to be careful about those products, to steer clear, actually, of hemp-derived CBD vape cartridges and so forth. It's unregulated.
Yeah.
It turns out there's a lot of crap in there because of the way they make the stuff. They include thinning agents and thickening agents and add artificial flavors, and all these things are potentially quite toxic. So when it comes to vaping, get it from a place, get the product from a place where you can trust. And to Dr. Rachel's point earlier, I think one of the problems is we've bifurcated the CBD market from the medical market. That's crazy. CBD started out in the context of medical cannabis. That's how it emerged in our culture, and that's where it should be. And it shouldn't be a CBD store on the one hand and a medical cannabis store on the other. What we want, ideally, in a medical cannabis market is a lot of variety, a lot of choices. We don't want everything to be sort of pigeonholed or tucked in. It's almost like trying to put the whole CBD market only in products that have less than 0.3% THC, which would qualify them as legally hemp. It's almost like, it reminds me of in ancient China where they would bind the feet of little girls so the feet wouldn't grow. That's what we're doing with medical cannabis when we're trying to stick it within the CBD hemp space. Now, that's an important space. That the fact that you can use cannabis for medical uses without getting high is significant. That should be an option for people. But ultimately, we know from the science that it's the THC, the high causer, combined with the CBD and the other components of the plant. That's really where the magic is. That's where the most value, the most potency, if you will. And I don't like the fact that in these so-called CBD only states, where you can only get these CBD products either with no THC or hardly any, you're missing a vast landscape of possibility in terms of therapy, in terms of personal use that you can access in a robust, well-developed medical cannabis market.
That's right.
Awesome. Thank you both. That wraps up our conversation today. I appreciate you both, your wealth of knowledge. I hope everyone had their pencils and papers out taking notes. But before we leave today's conference and today's panel, I would like both of our panelists to actually introduce themselves once again and tell people how they can stay connected. We're going to start with you, Martin.
Martin Lee, co-founder and director of Project CBD, projectcbd.org. It's a valuable resource for getting access about medical cannabis and cannabis in general, the whole phenomenon, because we see healing is not just about what one takes to feel better or to do better, but how one is interacting with society and the broader forces that impact health.
Thank you, Martin. I appreciate you once again. And Dr. Rachel?
Yes. All right. Well, you can find me on social at Rachel Doc Knox, and my family, Doctors Knox, at doctorsknox.com. But definitely also check out Minority Cannabis Business Association, minoritycannabis.org. We have rewritten our model bill, our state model bill this year, so be on the lookout for that. And MCBA is the first business league of color in cannabis, and we're writing policy left and right. So if you want to be involved in pushing for more equitable and what I say equity-centric cannabis policy, visit our website and consider joining. Thank you.
Yes. Once again, I appreciate you. And this again wraps up today's panel discussion on the state of medical cannabis. I am Tamara Russell, your moderator. And once again, I hope you guys enjoyed today's conference. Have a good one.
Thank you, Tamara.
Thank you, Tamara.
Thank you.